on diabetes in this month of November, which is also Diabetes Awareness Month. We have our speakers, Dr. Sheetal and Ms. Kiran, today with us. Dr. Sheetal Baravar is a diabetologist, general physician, and is a person with type 1 diabetes herself. Dr. Sheetal completed her MBBS in India and pursued her postgraduate training in the UK. She did her specialist training in obstetrics and gynecology, leading to DRCOG and DFSRH, following which she further trained in family medicine, leading to MRCGP with completion of certificate training CCSP in family medicine. Thereafter, she specialized in diabetes and did her postgraduate diploma in diabetes from Leicester University. Various hospitals in NHS during her 11 years in UK. She worked as a consultant diabetologist at Dr. Mohan's Diabetes Specialty Center in Domalkuda, Hyderabad, and is also associated with Rainbow's Children Hospitals, Vikrampuri. Her core area of work is in diabetes with special interest in pregnancy-related diabetes. And Ms. Kiran is a diabetes educator, insulin pump trainer, and assistant secretary of the non-profit organization called DAY, which is Diabetes Awareness and You. It is an organization in Kolkata which is continuously striving to make a difference in the society in its own little way to help prevent and manage diabetes, thereby adding healthy years to life. Thank you for making time in your busy schedules, Dr. Sheetal and Ms. Kiran. We are glad to have you both here. And over to you, Dr. Sheetal.
Thank you, Divya. Am I audible?
Yes, you are.
Thank you for your kind introduction. Firstly, I would like to thank Aasya for inviting me to give this talk. I'm privileged to be contributing in a small way to the fabulous work you all are doing in bringing awareness in providing healthcare services to the underprivileged and needy. It's a very commendable thing that you're doing, and I hope you grow from strength to strength. Today's talk is about diabetes, one of the biggest epidemics world is facing, and especially India is facing. And there's a lot of work to be done in bringing about awareness for this condition. So we're just trying to go through a couple of myths and facts through which we can cover a fair share of commonly asked questions about diabetes. I'll go ahead and start sharing my presentation. Yeah?
Yes, Dr. Sheetal.
Okay. Just give me a second. Tell me if you can see it.
Yes, Dr. Sheetal.
You can hear me and you can see my screen, right?
Yes.
So let's start So this talk is about myths and facts of diabetes. So the first slide, as you can see, when I call it an epidemic, I'm not exaggerating. These are real figures and they're staggering. So by 2025, 1 in 5 of us Indians would be diabetic. I mean, that's a staggering figure actually, and that shows the gravity of the problem we are facing. It's rightly called the silent killer, as many people go undiagnosed or are diagnosed very late once complications arise. I would like to point out 3 sentences here. First is that people can be undiagnosed with diabetes for up to 10 years, which is quite surprising for many people. But diabetes can build very, very slowly, can start very slowly and build very slowly, so much so that people don't even start getting symptoms because they get used to the high sugars. So that is very unfortunate. And that's why I think more than 35% of people we see already have complications at diagnosis. That is the problem we are facing. What we are seeing is only the tip of the iceberg, and a lot of people remain undiagnosed. It's only the tip that we are struggling to control and manage and trying to reduce complications for. but there's a whole lot of people who don't even know they have diabetes. And again, strikingly, 50% of almost 50% of people are under 60 years of age. It's no longer a disease of older age. We're seeing many people in their 30s, a lot of pregnant women are increasingly getting gestational diabetes, and many cases of type 1 diabetes are emerging too. So, this is a big problem, and it's also one of the major causes of death. So, every 10 seconds, a person dies from diabetes related causes. That itself is enough to tell you what we are looking at. So these are commonly, there are three types of diabetes. There are others, but I don't want to go into those. These are the common ones that people like to know about. So I'll go through them. First is type 1 diabetes. This is not very common, occurs mostly in children, but also can occur in adults. It presents suddenly because of some unknown trigger, we don't know why. Our own body's defense mechanism attacks and wipes out the insulin producing cells in our pancreas. So by the time they're diagnosed, there's already almost no insulin production left in the body, and this is irreversible. The only treatment, therefore, is multiple insulin injections, and the awareness for this condition is very less in India, and many kids end up presenting very sick and in life-threatening conditions before it gets diagnosed. It's more common in the Western world and less common in India, but nowadays we are seeing a lot of, it's changing, the patterns are changing. We're seeing a lot of type 1 diabetes cases, and it's very, very important to bring about awareness of this condition. Maybe firstly, so that we diagnose it on time, and secondly, so that children do not end up having lifelong complications. Type 2 diabetes is the most common diabetes, usually in adults, but we're now even seeing obese teenagers and younger adults with type 2. It can run in families, and it can also be because of obesity or being overweight. Gestational diabetes. Now, that is diabetes in pregnancy, mostly because of the pregnancy hormones. A lot of ladies also have family history, and because of the family history and pregnancy hormones, the sugars start increasing. Usually starts in the third trimester of pregnancy, and if you get a diabetes in pregnancy, it's almost like a warning that you have your future risk of getting diabetes is high, and that you should maintain a healthy lifestyle. Gestational diabetes disappears in most cases after delivery. Now, uncontrolled diabetes. I'm sure many of you might have seen these pictures, which look very depressing, but the fact is, uncontrolled diabetes can affect pretty much any organ in the body by damaging the blood vessels. So, that supply blood to various organs. So, it kind of attacks the main pipeline or the lifeline of a body, the blood supply system of a body. Hence, its complications are also far reaching and dangerous. Most common organs are heart, kidney, eyes, nerves, legs, circulation, but there isn't a single organ that is spared because of diabetes. And as you can see, it increases your risk of heart attack by 4 times. It's a major cause of kidney failure and dialysis, leading cause for new cases of blindness, and leading cause of lower leg amputations. So that is why it's very important to reduce disability, to reduce morbidity and mortality, that we have to control, we have to diagnose diabetes in time and control it early on. This is just a picture which depicts how diabetes develops. So here in the picture, our body cells have a lock, and insulin is the key. So insulin is the key that unlocks the doors and sends glucose into the body cells. So in type 1 diabetes, what happens is there is no key. The key is missing because there's no insulin in the body. And therefore, the glucose is not able to enter the body cells. And therefore, the excess glucose remains in the blood vessels, in our blood, and the levels go to a dangerous high, by which time the child is very sick and gets admitted in a very life-threatening condition. In type 2, however, there can be two issues. There can be less keys, meaning the insulin production might be low, or the body is unable to receive insulin in a good way, which is called insulin resistance. So although insulin is there, the body is not receiving it properly and it's not working properly. Hence, the sugars stay high. So let's go through some facts, myths and facts both, and then we get to know a little bit more about diabetes. The first question is, I'm 18 years old. Both my parents have diabetes. I was told that I'm at a higher risk of getting diabetes. Now, this is a common question we face because a lot of people are worried about their family history. And the answer is yes. There is a 50% risk if both parents have diabetes. There's a 25% risk if one parent has diabetes. But family history is something you can't change. But having said that, type 2 diabetes is a combination of many other factors, such as being overweight, increased waistline, increased abdominal fat, being sedentary, having sedentary lifestyle. So you can definitely work on all these factors and still try to prevent or delay the onset of diabetes. It's still very much in your hand. If you're overweight, by simply losing 5 to 7% of body weight, you can reduce the risk of diabetes by 50%, a stark 50%. So that's quite something. Exercising regularly, at least 30 minutes a day or 5 days a week, almost about 150 minutes a week of moderate intensity exercise, losing abdominal fat, reducing smoking, all of these can help in their own way. So do not be disappointed because of family history. You still have a 50% chance of preventing it or delaying it if you get other things right. Okay. Pavan says, I was told there's a cure for diabetes in Ayurvedic medicine by my uncle. So I will stop insulin and start Ayurvedic medication instead. Hooray, no more insulin shots. As much as Pavan would like to do that, unfortunately, despite ongoing research and the scientific advancement we haven't still found a definitive cure for diabetes, not for type 1, not for type 2. So if any herbal remedy can claim a cure, then that is definitely wrong. Herbal remedies are quite popular for many conditions. I'm not saying they're not, but they don't go through the same regulations as allopathic drugs do. For example, for allopathic drugs, they have to go through large scale clinical trials before their safety and efficacy is established, and that's when they can be used on people. Whereas herbal remedies do not go through such rigorous checks as compared to allopathy. So that's one concern. And the second concern is we do not know the impact of these medications on liver, kidney, and their interaction with the other diabetes tablets. So, because of both these concerns, I would be very wary, do your own research, and definitely do not stop your tablets or insulin. Some of the natural ingredients such as methi, kala jamun, they've all proven to improve insulin sensitivity marginally, but they cannot replace tablets or insulin. So please do not do that. Please do not stop tablets and insulin and completely switch to something which may worsen the problem. The third question, Tankaya says, I have very severe diabetes, therefore I was asked to take insulin shots regularly. Now, a lot of us type 1s keep facing this question all the time. Oh, you're on multiple injections, so that must be very severe diabetes. No, it's not. So, insulin shots are not just given for severe diabetes, or being on insulin doesn't make you a severe diabetic. In many situations, insulin is the preferred treatment, such as type 1 diabetes, pregnancy, adults with kidney problems, or where complications need to be treated urgently, where sugars need to be brought under control very quickly, such as before an operation, or when you are admitted in intensive care or in a hospital. And sometimes people cannot take diabetes medications because of gastric side effects. So they prefer being on insulin. And finally, if you've tried a couple of tablets at a good dose and we still don't get a good response, then the body needs insulin. Maybe the insulin production is less, so we're simply giving insulin. So just being on insulin does not make it necessary that you're suffering from severe diabetes. Okay, so one of the mother asks, and again, this is another very common question. I'm worried about the growth of my 16-year-old child who was recently diagnosed with diabetes. Now, I'm assuming the child here is a type 1 diabetic. There are lots of myths and issues and denials and challenges with type 1 diabetes. Type 1 diabetics who are well controlled do not have problems with growth, period. As long as their sugars are good, they can lead a completely normal life like any other non type 1 child. It's only when sugars are high, growth can be affected and complications can arise. It's important for type 1 diabetic families to accept that the child needs multiple insulin injections and diet control. Many families try to refuse insulin or cut down on number of insulin shots or do not encourage children to control diet due to pity or out of their love for the children. But by doing so, they're simply causing more problems for their child in the long run. So it's very important that, especially around type 1 diabetes, we have a lot of programs and workshops to keep empowering families, to keep encouraging them, to keep bringing the awareness that they look after their child's type 1, they look after their child's diabetes early on effectively by following the right treatment. People with diabetes are more prone to heart attacks. Yes, that's very right. So, being a diabetic makes you 4 times more risky to get heart attacks compared to a non diabetic. So, on top of it, so being a diabetic itself, you're 4 times at a higher risk of heart disease. On top of that, if you have high sugar, high BP, high cholesterol, you're not under control, you're obese or overweight, you do not exercise, and you smoke, then each of these things further increases your risk of heart conditions. So it's very important that sugar, BP, cholesterol are all under control. You should watch your weight, you should definitely take up some form of exercise, you should stop smoking, and also as like I said before, diabetes is a silent killer. So a lot of people do not get symptoms for many of these complications for even up to 20 years. People with kidney issues do not get any symptoms. And even with heart attacks, they're supposed to be silent heart attacks for diabetics. Diabetics are known for silent heart attacks. So you may not necessarily get symptoms. If you're waiting to get symptoms, then that is too late. So every diabetic should undergo annual every year cardiac screening for cardiac risk. Do they carry the risk? If they have the risk because they have sugar, BP, cholesterol, their weight is high, they smoke, etc., they have family history, then they should have appropriate screening tests so that they can pick it up early and start working for it. So this is a very important thing. Similar to heart, we also screen for kidneys, eyes, retina, your circulation. We do annual yearly screening so that these are picked up early and we are not waiting for symptoms to surface. So so this patient, Mr. Venkaya, like many other type 2s say, oh my God, it is too difficult to manage high BP, cholesterol, diabetes all together at once. Why me? Why all three of them? But unfortunately, they're like three brothers. I keep always saying that to my patients. They all usually start at the same time, typically, because they all have their roots in the same problem. It is the problem starts with your abdominal fat, which throws out toxins, which then cause damage to blood vessels, and therefore everything starts almost similarly or sequentially. So they unfortunately all three are equally important. If even if your sugars are well controlled, but your BP is high, your cholesterol is high, you're still it still can cause complications. You're still putting yourself at risk. So it's important that all three are well controlled because they can all three of them can damage blood vessels and therefore lead to complications. So yearly cholesterol tests and trying to keep your blood pressure below 140 by 90 is very crucial. Now, half of the job can be done by diet and exercise. Diet and exercise alone and weight control alone can solve all these three issues to a great extent. Beyond which, you've done your best, but still the BP is high, then you need to take some tablets. If cholesterol is still very high, you need to take tablets. The same goes with diabetes. So it is a lot of people just focus on medications. They say, why do I have to take so many medications? I do not want to take these medications. Fair enough. If you've given your best and still they are not under control, unfortunately you have to take tablets. Think of them as life-saving essential medications. Don't focus on the medications, focus on the complications. So by taking the tablets, if you can keep these three under control and live a good quality life, long life, healthy life, then there is the answer. That itself will motivate you to take control and also take the medications as instructed by your doctor. So the last, yeah. So Kantama says, now I check my blood glucose levels, doctor, once in a month near my diagnostic center lab, and they do the fasting and the post. They always show that my blood glucose levels are perfectly under control. So I'm perfectly all right. Now this is unfortunately a standard practice in a lot of rural areas or district level areas. It is standard practice. It's the old school style of checking only fasting and postprandial blood sugars and also adjusting medications based on that. Now that can be very inaccurate and dangerous. That one test of fasting and postprandial is only showing you that morning story, that it's only giving you that morning story. So if you, for example, ate heavily in the night, didn't sleep well, that morning's fasting could be high. If you've eaten very high carb food outside in the hotel before giving the blood test, that could be very high post. So based on that, if you change the medications or give strong medications, then that's going to prove wrong. At the same time, on a good day, most people, when they're going for a lab test, would take extreme care in the previous night. They've done their diet control well and they get a fantastic report to show the doctor fasting and post are perfectly in target, but that might not be the true reflection of their sugars. What happens after lunch? What happens after dinner? What happens on other days? So we don't know that with just one test of fasting and post. So now, obviously, the standard practice is to do HbA1c, which gives you the average sugar values of last 3 months. Now we have progressed from even HbA1c to continuous glucose monitoring and time in range and other things like that. But at least HbA1c should be a standard practice wherein a doctor looks at your last 3 months average and decides what kind of treatment is best suitable for you. I think we definitely need to move on from this fasting and post and get on with the HbA1cs and annual risk screening for various organs like kidney, cholesterol, eyes. All these are very important. Without these tests, we do not get information on what is happening in the body, and therefore we cannot give holistic care. The last one, I think after this I'll hand it over to Kiran. Amputation, blindness, etc., are unavoidable in people with diabetes. Now, this is absolutely wrong. Gone are those days where you only remember diabetics. Diabetes was synonymous with amputation or gangrene of the leg. Gone are those days because we have fantastic blood tests, we have early diagnosis, and after that we have loads of new and exciting medication that can effectively control diabetes. And we have ways to monitor sugars and understand more about how diet affects sugars, how exercise, stress, other medical problems affect sugars, and therefore we can jump in there and give the right treatment, a very customized, tailored treatment to each patient, so that we're never going anywhere near amputation and blindness. I think gone are those days. It's no longer that. As long as you're aware and you're doing the right thing and following the instructions, it is very much achievable. We don't have a cure, but we have excellent and fantastic control and monitoring systems now. A lot of new tablets and a lot of new monitoring systems. So there is no way to think that diabetes is like a life sentence. It is not. And a diabetic, I feel personally, my own experience also, since being a type 1 diabetic, I've been much more aware of my health and I've been so much more better in my lifestyle modification. So I think I feel on overall diabetics live a more healthy lifestyle because they're worried, so they put in that much effort and they live a very healthy lifestyle compared to quite a lot of others who are not taking care. So please do not think of diabetes as a punishment or a sentence. It's very much like any other condition you can live with and have a long, healthy, good quality life. I'll just hand over to Kiran.
Thank you so much, Dr. Sheetal. I'll take it on from here. Ma'am, can you stop sharing? Then I'll start. Yeah.
Yeah, thanks.
Yeah. Can my screen be is my screen visible? Yes, Kiran, it's visible. Okay. So, a very good evening to all of you. At the outset, I'd like to thank Aasya Foundation for involving me and my organization, Diabetes Awareness and You, to be a part of such a beautiful program. And heartiest congratulations to all the good work that you are doing. We are also a not-for-profit social welfare organization that deal with people living with diabetes. So we know what the struggle is and what are the achievements. So more and more strength to you, and hopefully we will do some good work together from now onwards. In continuation to Dr. Sheetal's very explicit explanation on the different facts that she was putting forward, in continuation to that, here is another fact from a person with diabetes. So Varun says that I have been smoking from a very long time and I don't feel it has any impact on my diabetes. Most of y'all, in and around either are smokers yourselves or maybe having people around you who, smoke because it gives a very feel good factor. But does it have any impact on your diabetes or not is something we are going to be discussing today. So let's look at his statements in two parts. The first part talks about that he has been smoking from a long, long time. So let's take up smoking and know a little bit about it. Now, whenever we think about smoking, even a small child to an old person, when we go for movies and these theaters and the initial advertisement comes, even the pack in which the cigarettes are sold, we see most of the time they give a lot of warning signs. They encourage people not to smoke and to give it up because it is injurious to health. So, what is this harmful component in smoking? Smoking basically it contains a product known as the tobacco, and that in turn contains more than 4,000. To be precise, there are 4,600 constituents in tobacco which are extremely harmful. Out of which there are about 70 to 80 products in the tobacco which are carcinogens. Carcinogens means these are products that trigger cancer. And hence we see that most of the time when we talk about smoking or when we talk about tobacco, we are generally talking about cancer and the different types of cancers that it may cause. And the only trigger to a person who's smoking to stop smoking is that it will prevent any cancer from developing. But tobacco in turn has lots and lots of harmful constituents. The two most poisonous substances that affects the people's health and general well-being is the first one is the carbon monoxide. So we have seen vehicles and buses on the road. The black smoke that is emitted from the cars and these buses is nothing but carbon monoxide. This same black color gas is also present in tobacco, which actually substitutes all the oxygen that is in our blood, and hence it is fatal to all the different organs of our body which require oxygen to function well. I think right now in this pandemic time of COVID-19, where we are looking at so many hospitalizations, the main reason being the saturation of the person goes down, and in need of oxygen, the people, they are admitted to the ICU, having different ways of giving them supplemental oxygen through ventilators and other things. So by now, I think what we understand is that oxygen is very, very critical and crucial for our body. When a person smokes, what we are doing is we are substituting this oxygen with the unhealthy carbon monoxide, and in return harming each and every organ in our body because they do not get enough oxygen. Other than carbon monoxide, there is also the tar, which is absolutely poisonous, and this is the sticky brown substance. It coats the lungs, again making it not letting the lungs function properly, which in turn affects breathing. Even after being so harmful, then why is it that people
again go on and smoke. And not one or two, they continue smoking. Once addicted, they continue smoking. It's because of this substance, which is the nicotine, which is present in the tobacco, which is the addictive element. The flip side of nicotine is that it obviously makes the person feel very very good for that small duration of time that the person is intaking this the smoke, but the flip side is that it harms all the other systems of the body. From the top right corner, from the central nervous system, it creates disturbance in the sleep patterns. You see abnormal dreams, there's irritability, there is dizziness, there is blood constriction, which is the blood vessels that provide the blood and the nutrients throughout the body. The heart is also compromised in a lot of ways. It increases the heart rate, it causes arrhythmia, it causes a lot of abnormalities in the heart, leading to coronary artery diseases. During pregnancy, also, it causes infertility on one hand, and on the other hand, the child that is going to come into life also suffers from a series of non-communicable diseases just because of the act of smoking of either of the parent or being exposed to smoke of other people actually smoking. Other than that, it also affects the gastrointestinal tract where it causes dry mouth, nausea, diarrhea, heartburn, peptic ulcers, and all other diseases. It also moves on to harming our hormones. Here, please note there is insulin also coming in and causes a lot of insulin resistance. The muscles, the bones, the lungs, the circulation, everything, all in all, the entire body is affected. Most of the people actually smoke because they think it's cool. I know most of my friends, when I was in college, they wanted to take the cigarette in their hand because it looked cool. Today's youth also, they take, they want to just fag because it makes them look much better and more cooler and more appealing to people. But that one stick, once the good hormones are triggered, which is triggered by the nicotine, please understand that the flip side is that all the other systems, all the organs of your body from top to toe is actually harmed. So these are the different risks that you get from smoking. So you can see right from stroke, blindness, the gum infection, the aortic rupture, so that's where it's affecting the heart, then the lungs with pneumonia, influenza, and all the other diseases that compromise the heart, then hardening of the arteries leading to heart attack, chronic lung diseases, COs, instant death and mortality in people. It also reduces the fertility and also affects the bones, which are present everywhere, leading to a lot of fractures. Part of what Varun had told us, one is that he smoked for a very long time and he wants to know whether it has any relation with diabetes. To start with, smokers are 30 to 40% more likely to develop type 2 diabetes than non-smokers. So if we compare individuals who have still not got diabetes, those that smoke have a 30 to 40%, which is almost half a percent, half more than those who do not smoke. People who already have diabetes, smoking, this nicotine, it has an adverse effect on insulin. So we all know that diabetes is where the sugar levels fluctuate, and this fluctuation basically happens because of insulin, which is actually the magical hormone which now we get available exogenously. So when for smokers, it increases the insulin resistance. In other words, it decreases the insulin sensitivity. So supposing for a smoker, if normally without smoking you require say 5 units of insulin to bring your sugar levels at a normal range, if you are a smoker, you will perhaps require more and more insulin for the same level of sugar that you need. So it reduces the effectiveness of insulin in a large way. There are several chemicals that cause harm to the body cell and it interferes with the normal functioning, as already told you. So it affects all the different organs. It also causes inflammation in the body and ultimately decreases the effectiveness of insulin, which we need that it should function to the best of its ability so that our sugars are in control. Now just think about it. Smoking itself independently, whether associated with any disorder or not, itself causes so much harm to the body because it has so many poisonous things, and we saw by the figure in the previous slide that it affects top to toe. Diabetes also, we know, if it is uncontrolled, also leads to a plethora of complications starting from cardiovascular to your renal, to blindness and other things which Dr. Sheetal has told us a few slides earlier. So imagine coupling these two, the diabetes as well as smoking. What kind of a deadly combination is this and what it finally does to the person? So today let me add on to another information that you have. A smoker also looks very different from the normal people. You physically deteriorate your dentures, your teeth structure, your face structure, your quality of your skin, because blood vessels, everything is affected. And did you also know that if you do not smoke but people around you smoke, even that is very very harmful, and this is known as a second hand smoking, where the smoke combination of the smoke as well as the burning of the cigarette that you are breathing in also harms you. So secondhand smoking is something that is we mostly ignore it. We feel that if we do not smoke, then we are fine, but it is not true. Even people around you, if they are smoking and you're inhaling that same air, it is equivalent to smoking, if not more harmful. Then there is an additional type of smoke known as the third hand smoke, and most of us do not even know this kind of smoking even exists. So first hand smoke is the person himself smoking. The second hand smoke is the person being exposed to other people smoking. And then there is a third hand smoke, which usually is what happens with children. So what parents generally do, they move the children out of the room while they are smoking, thinking that they are protecting their children. But let us not forget that the room in which you smoke, the environment in which you smoke, the nicotine as well as the tobacco settle. So on your couches, on your bed sheets, on the tables, on whichever area you are touching, the smoker is touching, it all settles there. And in future, when your children come around, they roam the same area, they touch the same furniture, they are also in turn inhaling the nicotine as well as the tobacco, which is in turn being extremely harmful to them. So other than you stopping to smoke, please ensure that all the people around you are also not smoking, and also people who are smoking, they do not smoke in the commonly areas that you normally would sit, you and your children. And this is what the World Health Organization statistics show us, that each year tobacco causes about 6 million deaths. Tobacco alone is causing about 10% of all deaths, out of which 600,000 of these occur in non-smokers. So it is a myth that if you do not smoke, you are fine and you're good to go. You also have to be very, very cautious of the people around yourself, as well as who is smoking in the vicinity around you, and the environment is clean as well as healthy. This is the biggest take-home message from this myth as well as fact which Varun has brought to us, that tobacco use is the single greatest cause of preventable death globally. So it is something which is in our hands. You can decide not to smoke today and prevent yourself from these complications of diabetes that can be added on and enhanced because of simply tobacco use. Also, you're putting the life of other people around you in danger, including children who come across with third hand smoking. So coming back to what Varun had told us, that he has been smoking from a very, very long time and he does not feel that it has any impact on diabetes. So this is a myth. It does. Smoking alone causes a lot of complications. When it is coupled with diabetes, it is even more challenging for the person with diabetes to keep the sugar levels under control. And the game of diabetes is all to do with having good control of your sugar levels 24/7 throughout the day. Let's move on to the next fact. This is from a wife who thinks that she may not get pregnant because of my diabetes. Now, this is a very emotional as well as a psychological topic. There is an entire community which is being set up for all persons living with diabetes, because when it comes to adolescents and getting married, this is a very, very big concern with diabetes. So more than often, whenever we are talking about diabetes, we are only talking about all the bad things that happen and all the things that we shouldn't be doing and all the things that lead to these very horrific complications, like the heart will not function well, and the kidney will get compromised, and the lungs and the liver is, and then you get a stroke and the blood vessels. But how about concentrating a little bit on the good? So what is diabetes? In simple terms, it is all about, it's a number game. It's all about numbers, where according to guidelines, if we maintain all our sugar levels, we monitor it well and we maintain it in the range that it is supposed to, you live a life equivalent, if not better, than a counterpart who does not have diabetes. So pregnancy, if we take, It is just another physiological process that comes in a human life. And so, if your sugars are maintained well, the pregnancy has no issues. So, where diabetes and pregnancy are concerned, again, it comes back to highlighting the same point that if you have poor control of your sugar levels during pregnancy, increases the chance of birth defects for the child as well as complications in the mother. But flip side is that if you have maintained your sugar levels well throughout your pregnancy, just as you are always recommended by your diabetes educator team as well as your healthcare provider to live your normal life with good sugar levels, no matter what you do and no matter which challenging activity you take up, pregnancy will be absolutely normal. So, for persons who have diabetes, it is recommended that you plan your pregnancy well. That is, before you get pregnant, you test your sugar levels and ensure that your A1C as well as your sugar levels are all in control. Here, I would just like to focus on another individual who does not have diabetes. So, a person who does not have diabetes, to speak to gynecologist, ideally by the time a pregnant woman reaches a gynecologist, she's already 6 weeks into her pregnancy. That is the usual visit to a gynecologist. Again, I'm talking about a person who does not have diabetes. Now, at that 6th week or at that 8th week, that is the first trimester, when the gynecologist recommends routine blood tests, sugar test is one of them. Most of the cases are found to be high during that time. Now, another known fact is that the fetal development, the baby is developed, all the organs are developed majorly in the first 8 weeks of pregnancy. Now, you tell me, a person who has diabetes, who is well aware of the condition, who is taking care of their sugar readings and planning their pregnancy well, as against a person who does not have diabetes, has an erratic lifestyle, plans pregnancy, gets pregnant, goes and suddenly finds out in the 6th week that their sugar levels are extremely high. What? So don't you think that in better condition, much more better situation where you have things under your control, where you can plan it well and plan and prepare for the upcoming fetus. Also, we must be well aware that during the 9 months of the pregnancy, there will be a lot of changes in the body, a lot of hormones will be changing, the placenta, there will be a lot of interaction on and off with the insulin. So we have to plan the entire 9 months along with our healthcare provider as well as our diabetes educator, keep a watch on our insulin levels, keep a watch on our medication, all other medication that we may be taking, physical activity, diet, all put together, and your pattern might change from trimester to trimester, and that is something that your educator team and your doctor will take care. So it's all about managing your diabetes even better going into the trial that is going to be coming. So coming back to her statement that she may not get pregnant because of diabetes, it's a myth. You can have, there is a very established doctor in Pune who is studying the trend of diabetes amongst generations. So he's been seeing a mother, perhaps who had diabetes, who gave birth to a child, whether the child developed diabetes or not, again following the trend of that daughter again to child. So it is beautiful how the mechanism works, and it is something which is in our hand where we can take control and give birth to a perfectly healthy child, keeping all our parameters safe and normal. Coming to the next fact, which is from Lakshmi, and Lakshmi tells Varun that it is not safe to exercise with diabetes, so take rest and stay away from physical activity. Now, in today's world, with so many cafes and so many restaurants and very innovative technology, food, mechanization, we all know the best meals to have, right? So that is something that we are putting into our body. That is food from which we gain energy. But as the law suggests, everything has to be balanced in equilibrium. And so what we eat ideally should be balanced with with the energy that we spend out, and that is in the form of exercise. Now, exercise by the word itself seems like a very hard activity that we need to keep in mind, and it's quite strenuous and stressful. But it is not like that. Exercise can be a very fun activity. It can be just a walk in the park. You can choose anything that you wish to do. You can walk, you can jog, you can cycle, you can do some gardening, some household work. and the recommendation is more than 5 days a week, and it should be 30 minutes per day. So there are many ladies who come to the clinic who says that we work day in and day out. What is the use of exercise? I do all my household chores. From morning till night, I'm on my feet, whether it be cooking or cleaning the house or whatever. But mind you, 30 minutes of continuous activity is what we term as exercising. So it is not something that you do, interspersed, like you do 10 minutes of maybe cooking and then 10 minutes later you are trying to clean something and then you sit down. That is not what is called exercise. So just you have to allot 30 minutes a day where you can do different activities that you wish. And exercise doesn't only have to be something like walking and something stressful. It can be fun. You need to stay fit, so it can be a sport, it can be Zumba, it can be a dance form, it can be swimming, it could be whatever you like. You must have fun while doing it, you must enjoy, and it should be a continuous activity for 30 minutes, 5 days a week. This is one big challenge that we are facing today, that is the screen time, especially with children who have also started online classes now. So you should manage your screen time something like this. So you must make, you can try this as an exercise where you can list the different screens that you watch. So your laptops, your iPads, your phone, your computers, or if there's television or anything that you watch, and you must distribute the time and see how much of screen time are you spending in a day and how you can reduce it by the weeks and spend more time in different physical activities. This is especially important for children right now, as schools have also turned online. The number of hours that they are spending in front of the screen is enormous. And the most important thing why we need physical activity is this obesity. Obesity itself is a pandemic. It is now known as a disease, and it is affecting so many people. It's known as the mother of all diseases. So it all starts with obesity. Again, too much of sitting, too much of burgers and pizzas and fast foods, and no physical activity, only screen time. Today, even cricket and football is being played on the iPad instead of being out there on the field and playing. More so because of the fear of the pandemic. But there are different ways in which you can get involved. There are online classes, there are dance classes that are being that have started now. So get your children involved. You yourself get involved. A small walk, around the house, in the park nearby, or on the terrace will do no harm. Coming to exercise and diabetes. So for diabetes per se, exercise has add-on benefits. So we have to look into our BG control. Sugar levels are much better when you exercise. It therefore reduces complications. It increases insulin sensitivity, which is our main aim. We want less insulin and more, sugar control of our sugar levels. It facilitates weight loss, which is a much required thing today, especially the waist circumference, which becomes a major problem. Then it helps to manage stress. So, for example, like what I like to do is Zumba, so that 1 hour of pure music and dance with all the fellow Zumbians around, it definitely releases good hormones in me and reduces whatever work stress that I may have. It reduces them. It does not allow the person to go into depression, the cardiovascular as well as lipid and BP control. A few slides earlier, we saw Dr. Sheetal talking about all these parameters where your cholesterol, BP, as well as your sugar levels are being maintained. So exercise is the answer. If you maintain and do your exercise within, on time, every day, very religiously, you are sure to maintain all these parameters. So it should not be so mind-boggling to maintain these parameters that could perhaps then come naturally. You should also keep a watch. This is very, very important for persons who have diabetes, especially type 1s. When you are going to do any kind of physical activity, you must keep a watch on your sugar levels before you start your activity and post your activity. We do not want any hypos. We do not want any complications to arise from you doing the physical activity. And you must also keep your sweets at hand should you face any hypos. An important point to mention here is also, other than the physical activity which takes care of your body, which keeps you fit, slim, and all those factors, what is also gaining importance right now is the mental well-being of the person. How are you being more mindful? So your depression, anxiety, stress levels, everything has an effect on your sugar levels. So even if you're fit, you're doing 1 hour exercise every day, you still see your sugar levels jumping, and that may be because of your mental well-being. it is not at par, and stress levels are high. So doing practicing simple things like meditation or listening to good music, songs, or whatever rejuvenates you is very, very important at this hour. What Lakshmi had to say, that it is not safe to exercise with diabetes. It is absolutely safe as long as you are sure of your sugar levels before and after. You have your snacking options ready and your sugar is absolutely in control. Exercise can be a lot of fun and there is no need to stay at home and take rest. You must be on your toes, up and about, living an absolutely normal and healthy life. Coming to a statement by a human resource manager of a company who says that I'm sorry, since you are a person with diabetes, you are not selected. So again, this has a very emotional as well as psychological aspect to it. I'd like you to introspect, and if you have ever gone through a situation like this, whether at home, at school, amongst friends or cousins, at your workplace with your lead managers, if you have been differentiated from the others because you have diabetes and there is, some doubt that they may have. You a live example. So through our organization, we also support our type 1 heroes, with insulin and awareness and counseling and all the other things. We are there with them hand in hand, just like a family member, to take them through and through. So here, I'll share with you the story of Ankita, who was diagnosed with type 1 diabetes at the age of 12 or 13, and it was the same, it was a DKA, so the sugar levels were extremely high, and she was admitted. Since she was 13, she was in school, and she has been facing these challenges of being differentiated with the other right from the time of diagnosis. So she had an issue when she gave her 10th boards, her 12th boards. She got rejected from a lot of jobs owing to the fact that she was type 1 diabetic. And I must tell you that right now she is, 30 years old. She is doing extremely well. She is a successful engineer working in a company. And just recently, last year, she went on a French exchange program where, she also got awarded the Best Employee Award. So coming back to Varun's, the statement where there is differentiation, can we think about what the other person is actually thinking? Why are they not selecting us just because we have diabetes? There are a few questions to consider here. Are they over concerned? Are they very, very protective about us? Are they scared that something might go wrong? Are they shying away from any additional responsibility because choosing us might increase their own responsibility, maybe as a manager, maybe as a teacher, or they simply don't know what diabetes is all about? Now, all in all, what I would like to say is, if there was a selection bias, if there was a limitation just because the person has diabetes, what about these people? What about him? What about Wasim Akram? What about Sonam Kapoor? And what about all these actors and actresses? So it all starts with the person himself. A few days ago, I was just scrolling through my Facebook page, and I'm a follower of Sadhguru. And there was a very short 30-second video in which he said that if you are ashamed of yourself, you have no right to live. You're the biggest loser on planet Earth. It all starts with you. If you are confident of yourself, if you have befriended diabetes and you do not think of it as a limitation, you have made diabetes your best friend, and you're trying to work hand in hand with it with absolute good sugar levels. You do all what is meant to be done for a healthy lifestyle. There is nothing to stop you. And to add to this is also your family. So your approach also affects your family's approach towards you. If you want empathy and sympathy and you want to be treated as a separate person, that depends on your behavior and attitude as well. Which, if it is tweaked and you are confident on yourself and your condition, as Dr. Sheetal said, that it is not a taboo. It's not, it's nothing to be bogged down about. It is just the insulin which you need to tweak, or your medication, as well as you need to be mindful of your everyday decision making. This situation of this HR not selecting the person if you have diabetes will never ever arise. So this is a myth that people with diabetes, we have so many success stories in and around us, so many successful people, and nothing stopped them. Nothing should stop you also. And this situation itself shouldn't arise, but should it arise, you must be there to take a leap forward and prove to the world that there is nothing different between you or any other individual who does not have diabetes. Coming to the last myth or a fact by Sunita, who says that my roommate is a person with diabetes and I might get diabetes soon. The only answer to this is awareness. So there are people around us. Let me quote you a live example. Through our organization, we have also adopted a village with 2,500 people, which is in the vicinity of the city. And this activity of ours began in 2010. And do you know that when we approached this village, we understood that 2,500 of them had never even heard the term called diabetes. So this is the knowledge level that is around this disorder. So nothing. This statement just brings about the fact that you and me together have to do a lot more work. We have to raise so much more awareness about the fact that there are communicable as well as non-communicable diseases, and diabetes falls under non-communicable diseases. I also know of type 1 diabetics who in their college life. So she right now is a doctor, and in her college life, at least she was in medical college. She was looked down upon when she took insulin. People thought she's on drugs. People told her to go and take insulin in one corner, to go to the washroom and put insulin. So these are the kind of things that even work in medical college. Perhaps these are the people who would, in 4 to 5 years' time become doctors of our country. So this is the awareness level of this disease. And as I shared with you, that village of 2,500 people did not even hear the term diabetes, let alone knowing whether it is communicable or not. But thanks to Corona now, at least the fact that it is a communicable disease and people are being made aware, somewhere they're also understanding the difference with NCDs versus communicable disease, and will now understand that having diabetes cannot spread, just as any other infectious disease. So, talking in terms of awareness, a very, very important fact that I'd like to share with you today is about DSME, which is Diabetes Self-Management Education. Diabetes, as we all know, is a chronic disorder. Once a person has diabetes, it is very rare that it is reversed. In very rare situations, the type 2 diabetes is reversed, but type 1 never reversed. So you have it with you all your life. It is perhaps your first soulmate who you need to befriend. Now, because it is a chronic condition, everything that you do day in and day out in your life affects your sugar level. So, not only what you eat or the exercise that you do, but even what you're thinking and how your hormones are behaving, or in which stage of life are you, whether you are an adolescent, whether you're an adult, whether you are getting pregnant, whether you're planning pregnancy, whether you're growing up as a child, or whether you're an aged grandmother. It all depends on how you're managing your sugar levels 24/7 into 365 days. Even your sleep patterns, your waking up patterns, your exam time, non-exam time, your happy times, your sad times, everything put together affects your diabetes. So it is crucial that you learn how to manage your diabetes yourself, and hence the term diabetes self-management education. It is something which is possible, it is something which is achievable, and it is something that you learn through the years and you can master the art. In fact, it's a myth that very small toddlers, if they have diabetes, they cannot manage their pump or understand hypoglycemia. In fact, the president of our organization, Dr. Vasu, says the age of the child is directly proportional to the number of days the child will take to settle down with diabetes. So if the child is 4, in 4 days we expect that the child will be able to manage and understand diabetes to begin with. So this is a process. It's a process of facilitating knowledge. So it all starts with awareness. You need to know the theory. You need to know the essence of the disease and what comprises of it. You also have to develop your skills. So how would you give your insulin shot? How would you store your insulin? How would you treat a hypoglycemia? What are the signs that you feel of hypoglycemia? So you also have to have a mindfulness and awareness as well as skills to handle your own condition. So what does DSM mean for a person who has diabetes? It means understanding diabetes, what is the condition all about, as well as what are the treatment options which are available. It also includes healthy eating, so what are carbs, what are proteins, what are fats, how much of each should you eat in a meal, and which type of carbs affect your sugar levels adversely and for which. So I know of someone, when she eats sweet, jaggery, it has no effect on her sugar level. But when she has tamarind, which is the khatta water of pani puri, that affects the sugar levels like anything. So it is a self-learning that you do with time and what is healthy eating for you. Also, being physically active is what we have already discussed, improving your strength, your endurance, as well as maintaining the correct BMI as well as the waist circumference. Taking medications as prescribed. So here you have a lot of sick days. You might feel cold or fever on a particular day. How to manage your medication on those days, or when you have missed a dose, how to manage that condition as well. Checking your blood sugar. So there are many ways of doing it. How often should you do it? Which device you should use to do it? When should you do it? And what is the interpretation? I know of a type 1 mother who was very religious in checking her child's sugar levels. Every morning after meals, PP was there, the 7-point program was done on and off. But she had no idea that a 400 blood sugar level was abnormal. So her records were all around 400 plus minus 50. So she knew that she's supposed to do the monitoring, but she had no idea of the interpretation of the blood sugar levels, which is one very important thing and comes back to DSME, where education and awareness is needed. Also, once all of your sugar levels and all these, you eat healthy, you stay active, the risk of all other health problems is drastically reduced. You also need to learn how to deal with stress, depression, as well as other concerns. So life is not going to be a straight line. You will have this condition all throughout your life. So there'll be ups and there'll be downs. There'll be, your birthdays will come and you'll have celebrations. You have additional doses of your birthday cake, and then there will be low moments where perhaps you face a challenging situation. So you must know how your sugars behave and how to counterbalance that with all the things that your provider has provided you with. And or any other symptom that you may have, like pain, hypoglycemia, hyperglycemia, and all the other stress and emotional problems that come in life. And the most important thing is to work effectively with all healthcare providers. So this diabetes self-management education is along with the team of provider as well as the educator who help you, who support you, as well as give you all the important material which is research and evidence based. So don't go and fall with what you sometimes read and learn which may be myths, as we are discussing today. You discuss with people from scientific background who have the correct knowledge and who will be able to guide you correctly. On the whole, diabetes self-management education is a 6-process ongoing cyclical process. So it all starts with the assessment. So let's take an example here. You assess your own condition. So say for example you are overweight, or your sugar levels or your HbA1c is around 8. So it's assessing your basic level or your basic condition, the overall condition of the person. Next is the goal setting. So now that you understand the problem area, you set goals accordingly. Like for example, your HbA1c in the next 2 months will come down to 6.5, or your weight will come down by 5 kilos according to whatever your educator recommends to you. Next, you put a plan in place of how you're going to, what are the changes that you're going to make in your life to achieve the goal that you have set. Then you implement it. After implementation, you monitor and evaluate it. So you maintain a documentation of it. So for example, the chart that we saw, the screen time, so maybe a reduction in screen time and an increase in physical activity, or a reduction in the carbs, which you have noted, you have done carb counting in the last 2 months, and you have increased proteins in your diet. So all of this can be documented so that not only you, whereas your educator and the team can also assess your condition. So there is a very famous organization run by Dr. Sarda, and she says that every Sunday or once a week, it is set by the child to evaluate how the last 1 week went. So whatever they have set in their mind, whether they achieved it or not, and how they can improve. So if they saw, say, 5 episodes of hypoglycemia, how they can make that to no episodes of hypoglycemia in the following week. So once a week, 1 day a week is something that you keep for yourself. It's often called the me time, when you can sit and evaluate your own condition and do well for yourself for all the parameters that have not been satisfactory. And this you can do along with your educated team as well as the doctor who is waiting to see and learn about your progress and know about your personal health. This is a small slide that shows how diabetes self-management education can improve A1C levels, and obviously once A1C levels improve, the overall outcomes improve, and the cost, the economic burden of diabetes is drastically reduced.
Thank you, Dr. Sheetal and Ms. Kiran. It was a very, very informative session. Since we are running out of the time, floor is open for questions, and we'll take one or two questions and wrap up this session. I hope that's fine with you, Sheetal and Kiran. Is it fine, Sheetal?
Yes.
So,
Yes.
Anil Raju have a question here. He says, is there any chance for type 1 diabetics to take tablets instead of insulin in future, maybe in coming a year or two? And he also asked another question, that is, any clinical trials going on for type 1 diabetic
ఫోన్ ఇక్కడ ఎందుకు ఇప్పించావు డాడీ నువ్వు ఎక్కడ ఇప్పించావు కోకట్పల్లిలో నువ్వు మదర్ బోర్డ్ ప్రాబ్లం అన్నాడా
Thank you, Divya.
ఎందుకు వద్దని చెప్పావా
చెప్తాను వస్తే బాగా చూసేది పర్వాలేదు
very quickly destroyed by the enzymes. But we are working on it. There's a lot of research going on as to how we can package insulin as a tablet, which will be resistant to the enzymes and should be able to deliver and do its job. Also, there is a issue with the dosage of insulin. How much should be packaged in a tablet, and how well it will go and affect and impact and show its efficacy on different organs. It is definitely something which is being worked on. I don't see that happening in the next few years. So that is one of the reasons. And if I had to answer, unfortunately, other sugar tablets, not insulin, but other sugar tablets for type 2 diabetes, those are absolutely not going to help type 1s at all, because all those medications are designed to either increase the production of insulin or improve the sensitivity. But in type 1 diabetics, since there is no insulin reserve in the body, these tablets will not act and therefore will not control the sugar. So type 1 diabetics will need insulin, but let's keep our fingers crossed that sometime soon we see those insulin tablets. Yeah, the second point was the research and the trials. Yes, there's a lot of trials going on. There's trials on whether we can have stem cell transplants. So the stem cells are basically, we're trying to regenerate the insulin cells that have been lost. So the same beta cells of pancreas that have been lost in type 1s, whether we can regenerate them, whether we can introduce the mother cells. All our body cells come from some basic mother cells. So whether we can introduce them, implant them, and hope that they will regenerate the beta cells of pancreas. There's a lot of research going on, but it also is almost like a procedure, a transplant procedure. They're being done. It's not like it's not being done, but just like any other foreign body enters the body's defense again attacks it and destroys it. So even with stem cell transplants, the longevity of the efficacy hasn't been of great success. People have not, so the stem cells have not survived beyond 5 years. So there is research going on in terms of trying to regenerate the pancreas back. Again, we've been hearing for many years it's coming. So far, I can say confidently in the near future, next 5 years, I can see that happening. Being around for every day sort of coming out to use it and
Thank you, Dr. Sheetal. Yeah, I'm really looking forward for that. The last question, so it's a very, very frequently asked question. Can eating sugar cause diabetes? So, Kiran, would you like to answer this?
So, the most important thing that I keep hearing from all the qualified dietitians is moderation is key. So, it's not a fact that eating sugar can cause diabetes. It is basically when we eat anything, pancreas produces insulin and tries to bring down the level, putting all the sugars in the cell, and the remaining it converts to glycogen in the liver. Now, the more sugar that you eat, the more insulin that your pancreas needs to produce. So it's just like a machine that runs in accordance to whatever you input into your body. Now, with time, as the machines of any factory keep working, there is at some point it gives way. And that is why eating too much sugar, I would say, overworks the pancreas at a certain point, and you may get diabetes. But just having sugar, having a lot of sugar, for a child or for somebody whose pancreas is well functioning, then that does not lead to diabetes. So all in all, it's just the same way of asking whether too much of fat can lead to a heart attack or things like that. So it is very individualistic. It is a very individualized approach. You need sugars, yes, but you need it in moderation. Overdoing anything to your body is not good, and so would be sugar.
Yes, thank you, Kiran. This is for all. So, if you have got anything to share, please provide your valuable feedback through the link provided in the chat section, which is in the bottom right corner, usually, if you're on a desktop. And thanks a lot, Dr. Sheetal and Kiran. It was really very informative session. We got to learn a lot of new things. And thank you for taking time in your busy schedules to help us out in understanding a lot of things. So, yeah, this is all about it. And I would also take this opportunity to thank Lakshmi Narayana. He had been working hard behind the scenes, and also Ram Gopal and Sri Ramakrishna. So, this is it. And yeah, would you like to add anything, Dr. Sheetal and Kiran?
Nothing more. Thank you so much again, just to give us for giving this opportunity to be on this platform with all these wonderful people who are doing such a great job. Thank you. Anytime, it's a pleasure to be, to be on such a platform to bring about awareness about diabetes. Thank you, Divya and Lakshmi, for all the hard work, and thank you, Kiran.
Thank you, Dr. Sheetal. Thank you, Aasya Foundation once again. Divya, Lakshmi, thank you so much. It's been a pleasure.
Our pleasure as well. And important note to all. So every state has got its own support groups for diabetes. For example, Speed Zones is working in Andhra Pradesh and Telangana. Big AY is working in Kolkata, and Blue Circle in Maharashtra. So like this, every state has got its own support group. So please pass this information to people with diabetes, so that these support groups are really helpful in educating the people, and also in counseling them, and also a lot more supportive. So that is it. And again, this is just a reminder. Please provide your valuable feedback through the link provided in the chat section. And thank you all. Take care and bye bye.
Thank you.
Bye. Good night. Thank you.